everyone. Welcome to the Concussion Discussions series brought to you by Integrated Brain Centers. I am your host, Amy Zellmer from Faces of TBI. And in this episode, I am talking with Dr. Jonathan Chung from Keystone Chiropractic and Neuroplasticity. And today he is talking about Protect the Neck, treating and preventing a primary source of concussion symptoms. So really excited to have you here today, Dr. Chung, and just a really important topic. I don't think people think about the neck when it comes to concussion as much as we probably should. So really excited to hear what you have to say today.
Thanks for having me on, Amy. Always a pleasure to do some stuff with you and work on some projects with you. And we're hitting my favorite topic, which is the neck. So, always happy to contribute to that aspect.
Yeah. So let's kind of dive in, with what the neck, so like for me, I fell on the ice. I had pretty significant whiplash. And people who've been in a car accident or other fall accidents, they can definitely be having neck problems and possibly not realize that that's what's causing some of their concussion symptoms. So let's just kind of jump in.
Yeah, absolutely. So it's been one of my passions is taking care of the neck, even before I got into the world of concussion. And we just see how many symptoms that problems in the neck can really generate whenever there's an injury there. And being a chiropractor, we work with a lot of patients that are involved in auto injuries. So we see a lot of whiplash patients coming in, but a lot of these patients that have whiplash, they've also suffered a concussion, even if they haven't hit their head. Mm-hmm. So in the past 10 years, it's translated to a lot of research in the concussion space about how much the neck is injured during some of these concussive injuries. And Dr. John Leddy, who's probably been a strong pioneer and leader in this space, he did a study that showed that patients that had a concussion and patients that just had a whiplash, if you just gave doctors their symptoms alone, you couldn't tell the difference between someone with a neck injury and a primary concussion. So that goes to show us that, hey, if you have a neck injury and you had a concussion, there's a chance that your concussion symptoms might be coming from the neck. And if you're just treating the brain itself, which obviously everyone should do is treat the brain, you might be missing one of the most important symptom generators and the things that might be causing the problems, especially when it comes to dizziness and headaches, which are common in both whiplash and concussion.
Yeah, and I would think the opposite would be true as well if you're only treating the neck and not treating the brain. I know that was me. I was seeing a chiropractor for 2 years, and he was just simply working on my neck. And so I assume that it kind of goes both ways.
It absolutely goes both ways. And that's where I made my transition from being an upper cervical chiropractor, which that is, my primary role in my practice is taking care of the neck, but I've also integrated functional neurology into my practice because I was seeing a lot of patients who got better by taking care of the neck, but they were still having these issues and they were plateauing. And it's by bringing in functional neurology and working on their eye movements, improving their vestibular system, addressing aspects of dysautonomia, where we're able to get a more complete type of recovery for people by combining the two and really paying attention to both aspects of it.
Mm-hmm. So when you have a patient come in who has a neck injury and potentially, a concussion as well, what are some of the things you're going to assess and look for and potentially treat?
Absolutely. So the biggest thing that we're looking for in a concussion and neck injury we're looking for what is the integrity of the upper neck. So the upper neck is the juncture where your 10-pound head sits on top of these two little bones called the atlas and the axis. And the atlas and axis are pretty unique in the spine because there's no hard disc that is sitting between the atlas and axis and between the skull, which means that the upper neck is really, really mobile. It's what gives us the ability to turn your head side to side. It allows you to bend. You get a lot of range of motion from the neck, but it also means that it's very susceptible to injury. Mm-hmm. The things that hold the atlas and axis together are a series of really small muscles and a bunch of small ligaments. And these muscles and ligaments are very easy to injure. So one of the things that we'll notice is that when someone has a neck injury, they'll have very tender nodules that sit on the back of their skull. So if you press on the back of the skull, a lot of patients that have had a concussion will actually feel this radiating pain that goes over the top of their head, or it'll shoot into their eyes. And that indicates that that C1 or C2 nerve root is contributing towards some of their pain symptoms. The other thing that we'll look at is if I turn my body and keep my neck and twist my neck, but keep my head straight, if you look at the person's eyes when they have that position, you'll actually start to see that their eyes will start to shake. And that's called the neck torsion, smooth pursuit neck torsion test. And it's one of the ways that we identify if someone has cervicogenic dizziness. So those are two big assessments that we'll do on all of our concussion patients. And we'll also do a test called a joint position error test, where we say, close your eyes, turn your head, bring your head back to center. And if you bring your head back to center and you overshoot it or undershoot it by a lot, that means that your brain doesn't really know where your neck is in space. And we have to do some rehab in order to try to address those aspects. When we identify that there's a neck injury, then we'll also do an eye movement scan using some specialized goggles to measure their eye movements. And then we'll also do a pretty thorough physical exam and just measure different aspects of brain functions too, so we get a complete clinical picture of what's going on with that patient.
Mm-hmm. And I think that's so fascinating, the whole like closing your eyes and seeing if your body knows where you are. It seems like such a simple, straightforward test, but yet most traditional doctors, do nothing with that. So, I struggled for 2 years, right, with just going to a standard chiropractor, not knowing that there were functional neurologists and upper cervical chiropractors out there. And it, when you get to the other side and you get the right treatment, it's so fascinating how relatively simple a lot of these tests are, and they're just not being done on people. And you can find out so much just with the eyes.
It's really
and the neck.
unbelievable because like these tests are very easy, like almost anyone can do them, but if the doctors aren't educated on what test things to look for, then things are going to get skipped. And in today's the way that medicine is practiced today, a lot of people just go off their health history and you get a diagnosis just from talking to the doctor. But if you're not doing an examination, then there's a lot there that can be missed. Because if you go to a doctor and you just say, you know what, I hit my head about a week ago, and after I hit my head, I've been having dizziness and headaches, and automatically you're almost instinctively going towards a concussion diagnosis. And prior to the past 20 years, they would have just said, all right, just, put yourself in a dark room, close your eyes and wait till your symptoms get better. And now we know the opposite is the thing that you have to do. You need to, start getting active a lot faster, and you have to actually assess the neck and the vestibular system because those play such big roles in people's recovery.
Mm-hmm. Yeah. Yeah, the whole sit in a dark room. I know that was what I was told as well. And I mean, if I would have sat in a dark room till my symptoms went away, I'd still be in that dark room.
Yeah.
Like they're not going to go away on their own. And it's just such an archaic way of thinking. So what are some things that you can do to help patients? Let's kind of maybe break it down to like cervicogenic headache. And I remember early in my recovery, I had a lot of cervicogenical dizziness too. I had a lot of dizziness, and I remember doing research and finding out about cervical dizziness. And I brought it up to my chiropractor, and he basically told me that that's just a myth, that that's not a real thing. Which in hindsight is so frustrating, right? Like you get all these different thoughts from different doctors, and it's really frustrating because you don't know who to trust or who to believe or who knows what they're talking about. So what are some things you can do to help those patients dealing with the headaches and the dizziness coming from the neck?
So when people come in with headaches and dizziness and we suspect that the neck is the cause, our primary intervention is what we call a NUCCA chiropractic assessment. So NUCCA is a form of chiropractic that focuses in on the head and neck area, and it's very gentle, it's very precise. So the first thing that we do is we'll take x-rays of the top area of the neck, and we'll measure exactly how that area has been displaced. once we recognize how it's been displaced, then we use very specific angles at which we've applied pressure to the neck. And using these gentle pressures, we could actually realign those vertebrae. And just from the realignment, like about 80% of our patients will experience some improvement, especially when it comes to the dizziness aspect. Depending on what part of the spectrum they are with the headache, they might need to wait a little while before the headache can kind of dissipate, because inflammation is such a big trigger for a lot of the headache symptoms. And until that inflammation gets out of there, it's hard for a headache aspect to recover. So we usually tell people, after you've had a head injury and you've had a cervicogenic headache, it might just take 3 weeks to a month before the headache starts to break down, even if you're doing everything right. So it's just about enduring that aspect then. In addition to that, we'll recommend cervicogenic rehabilitation techniques, where we'll do that eye head positioning exercise. So one of the things that we'll do is we test people by saying, all right, close your eyes, turn your head, bring it back to center, and then see where your head is positioned. So it's one thing to know that you got that position wrong. It's another thing to actually fix that problem. So we'll put a laser on the person's head, have them turn their head, bring it back to center. They will physically see where their head missed the position. And that gives feedback to the brain that says, oh, I missed it by 6 inches. Let me bring it back. So the next time they get it back. And then they do that over and over again. So they build plasticity. So they teach the brain, this is the way that my neck is supposed to be. So that's called a joint position error training exercise that we'll do. We'll also do neck strengthening exercise. So we'll get people to lie down on their back. We'll have them lift their head up and start to build endurance for their neck muscles. And that's something that we'll have our athletes do, because we know that for every pound of neck strength that the person has, you reduce your odds of concussion by magnitudes of 20, 30%. So just by getting your neck strong, you might actually prevent yourself from getting future injury down the road too. So we use strength and conditioning of those neck muscles, not only as therapy, but also as prevention.
Yeah, that whole neck strength, that research is really fascinating, and how, especially among athletes, female and male athletes, and that neck strength, because men tend to work on their neck and have stronger necks where women don't. And women tend to have the longer, daintier necks, right? Versus men.
That's correct.
And so I think that's really fascinating. And, women don't want to work out their neck because they don't want to get a thick neck, but that's in reality not at all what's going to happen. So yeah, the whole neck strengthening. And I know when I did my neck strengthening originally, it was so hard and it triggered awful, awful headaches.
Yeah.
But you have to work through it, so to speak, right?
Yeah. And a lot of it also comes with, like, when we go through and we rehabilitate a patient, we don't want you to have this maximum expression of your symptoms, but we also don't want you to be afraid of stimulating it a little bit either. So we give people a guideline. Let's say, like, if you have neck pain that's, a 5 out of 10, while you're doing your neck exercises, don't be afraid to go into the 6 or 7 range. But if you're getting to 8, 9, 10s when you're doing it, then probably don't do that quite yet, and just do a lot less work until you can work yourself up to it. So there's ways of getting to that point, and we don't want you to, blow yourself out mentally and physically and emotionally from exercise. But we do want you to develop a sense of resilience, meaning we don't want you to be afraid of doing things that cause symptoms, because it's our ability to confront those symptoms that will eventually teach our brain to say, you know what, it's safe to do this, even though it hurts, I'm not in danger. And then eventually your brain will figure out a way to inhibit a lot of that pain that's coming from there.
And in this concussion discussion series, Dr. Jerome Libby is talking a lot about that. The like safe, am I uncomfortable or am I unsafe? And being able to distinguish between that. And I never had really heard anyone talk about that before. And so it's awesome that you're bringing it up as well. So do you even want to go just a little bit deeper into that?
Yeah, absolutely.
With rehab?
So one of the things that's important to remember is that your brain can sometimes develop symptoms because, not necessarily because something is wrong, but it's perceiving that something is potentially dangerous.
You're literally like getting in your own head.
Exactly right. because it's instinctual. Let's say that you sprain your wrist. So if you sprain your wrist, you have all this swelling and inflammation here, and generally your body doesn't want to use that wrist anymore because it's worried about instability. So it does all these things so that you don't move that wrist.
Yeah.
So every time you move that wrist, it's going to create a little bit of pain. So that's like a sensitization response that is actually adaptive. It says, you know what, your wrist might potentially be seriously injured. Let's make sure that we don't move it at least for a little while until we heal things up more. But if that sensitization response stays with you, then you start to become afraid of normal physiologic movement. And if you're afraid of normal physiologic movement, every time you do that movement, it's going to send a signal that says, ouch, this hurts, don't do this anymore. And then that's where you get this signal that's not necessarily adaptive. It means that your brain is perceiving something as being unsafe, even though consciously we know that it's safe and it's not going to injure yourself worse. Same thing happens with dizziness. If your brain feels like it's unsafe, then you're going to have some of these visual sensitivities where a fast moving background is going to make you feel a little bit disoriented. So when you feel disoriented, your brain doesn't feel safe. It's an environment. So instinctively, you're going to avoid that. You're going to sit down and you're going to try to avoid that sensory stimulation. These hyperreactivity to basic stimulation is a big problem, because if we continue to avoid it, then we never teach our brain that it's safe to confront these things. And if you continue to avoid it, then every time you confront it, you're going to face that symptom again. It's only when we continue to push that threshold little by little, week after week, that your brain can say, you know what, I experienced this last week. I was fine. Nothing bad happened to me. So now I'm going to inhibit this desire to create symptoms, even though, I don't necessarily feel safe. And eventually you'll get to a point where you could just walk into the middle of an open space and not feel anything, because you've already done such a good job convincing your brain to say, it's okay for me to be out here and nothing bad is going to happen to me.
Yeah. Yeah. And I think that's such an important element of recovery, because the vast majority of people after a brain injury, they have a lot of anxiety, and that anxiety comes from that fear of like hurting yourself again. And the longer you go without proper treatment, the worse that anxiety gets. So, someone might come into your office, and I was guilty of this when I started my treatment with functional neurology. Like he wanted me to do a movement, and I knew that movement was going to make me dizzy. And I'd be like, okay, this is going to suck, but I'm going to do it. And, I like mentally prepped myself for it. Like, I'm safe. He's not going to let me hurt myself. I'm not going to fall. If I do get dizzy, he's going to catch me, like he knows how to help me. And so that's really, really an important factor in going in for treatment and recovery.
It's super important. It's probably one of the most important things to educate people on, is to know the difference between, ouch, this is something that hurts and it's uncomfortable, versus, ouch, this is something serious and it's potentially threatening to my ability to survive. And the vast majority of people, when they have chronic pain, it's not threatening their ability to survive. It's a signal that says it perceives something as being dangerous. So if we could convince the brain that, hey, just touching your skin like this is not a threat to you and you're not making an injury worse, then they can make these breakthroughs that say, you know what, even though this hurts, I can endure this. And if I can endure this long enough, my brain's going to figure out a way to make it stop hurting. And that's a big step for a lot of people, which takes them from, you know what, I'm afraid of doing exercise, so I'm going to avoid it, to I'm going to do exercise. It's going to hurt a little bit, but my body is going to be better off and it's going to be stronger because I did this exercise.
Yeah. Yeah. Such important information right there. And anybody watching, you might want to just even back up and watch that over again, because it's such a key component to your recovery. So Dr. Jonathan Chung, such a pleasure to have you here today. You are very unique in that you're an upper cervical chiropractor with the functional neurology training. And I think it's such a great complement to each other. And if people want to get in touch with you, you do phone consultations.
Correct.
And they can find you at chiropractorwellington.com. And you're located in Wellington, Florida.
Yep.
Any other way you want them to get a hold of you?
Sure. So I'm pretty active on social media. So
You
if
are.
you're on Instagram, you can find me at Keystone Neuro, and we create a lot of brain-based content for people on that Instagram channel. You could also find our practice page on Twitter at Keystone Neuro. If you want to find me on my personal page, where you want to see pictures of exercise and my kids and stuff like that, at Dr.
Your
Jonathan
adorable
Chung.
children.
So we have those channels available for you too. And yeah, if you ever want to talk on the phone, we'll do a 15-minute consultation at no charge. And we have intensive programs available for people if they feel safe enough to travel through this craziness that's happening. But if you do, then we're happy to help you and take care of you if you ever find yourself in Florida.
Awesome. And we'll have all that information below the video. So be sure to click through and follow Jonathan on social media. He puts a lot of really great content out on his Keystone Neuro Instagram page. You put out a lot of useful content. I'm always loving, and I always love reading your posts. So thank you so much for being here today and being a part of the concussion discussions.
Thank you so much, Amy.